Bonjour et bienvenue dans Topik Konversasyon pour aujourd'hui bon matin. Et pareil, moi dit dans Topik Konversasyon aujourd'hui, nous joignons pour encore une fois avec Dr. Suganya qui joignent aujourd'hui bon matin. Aujourd'hui, topic qui nous aborde, nous tous un petit peu bonnes hommes. Aujourd'hui bon matin, bien sûr, nous cause infertilité de bonnes hommes qui sont l'impact bien sûr, pour fertilisation. Tout ça là nous pour causer aujourd'hui bon matin. Pas hésiter, bonnes hommes, pas comme là bon matin. Bien sûr, pour demander nos autres questions, il concerne nous tous. Par exemple, on dit, il n'y a pas personne qui est parfait. Si on a un problème, nous avons un problème. Alors, si nécessaire, better safe than sorry. Nous la réponse, bien sûr, pour nos questions. Alors, aujourd'hui bon matin, c'est Dr. Suganya qui se joint. Bonjour, Dr. Suganya.
Bonjour, Carol.
Comment ça va?
Moi bien, merci. Comment vous, ça va?
Moi, très bien, merci. Bien dormi, bien levé?
Yeah.
Yes?
Yes, I've been doing well.
Okay. Welcome back to Seychelles.
Merci beaucoup.
Bienvenue dans le studio Bonjour CC, encore une fois.
Yeah.
So, how is it since the last time you left?
Yeah, no, the surprise here we have the FIFA World Cup happening, the big soccer happening.
Are you excited?
Yeah.
Are you going to watch at least one match?
Yes.
You are?
I'm looking
Did you buy your
forward.
tickets already?
No, I've asked them to get one for me.
You have to get one today, or else you will not get it because it's almost finished.
Oh, that's informative and much appreciated.
En fait, Dr. Suganya, il y a son ticket pour lui, I get FIFA Beach Soccer, bien sûr. Il y a des gens familiers, si d'abord juste c'est la présence, la façon que vous texte nous, il n'y a pas un problème à cause qu'il comprend bien créole. Tout ça, les tailles peuvent venir en CC, bien sûr. Si vous texte nous en créole, il bon, texte nous en anglais, texte nous en français, tout ça là. Il bon même. Infertilité, deux hommes, aujourd'hui, bon matin, the subject we touch the men today.
Yes, the subject we are going to discuss primarily is the male infertility and what solution we have. Most of the time we think that infertility is mostly oriented with women. The lady is not conceiving.
Is that true? Sometimes we women get blamed for that.
Yes. So every time the women sees her period, the couples totally lose their hope and point fingers only on the lady because we are blessed with womb and we are supposed to carry the baby inside. But there are two sides for the coin. Now, as the men are involved, so as the lady is also equally involved. It's 50-50.
50-50.
So, yeah. Always the healthy sperm has to swim up, reach the egg, and then only the baby can happen. So, this is the key factor here. So, we are going to highlight on the male factors which are probable reasons for getting delayed pregnancy or not getting pregnant at all.
But the sperm have to be healthy.
Yes.
Or not?
Yes, the sperm has to be very healthy and it has to be in good shape, especially the head, the middle portion and the tail part of the sperm.
Explain, elaborate the in good shape.
Yeah, the good shape is similar to kind of a small fish. As you see the head of the fish, the body.
It's like a tadpole.
Like a tadpole, yeah.
Yeah.
Yeah, exactly like a tadpole.
It must be like that.
Must be like
and very
that.
healthy.
Very healthy. It should not have two heads. Which
Two
is
heads?
Yeah.
Can that be possible?
Yeah.
Really?
Yeah. Abnormal forms of sperms will be two heads, absent tail, no neck, and dead sperms, and lot of pus inside. Lot of pus cells inside, infection. So, when the tadpole like you see with two heads, two tails or no tail, then we know the factor lies on the men and need correction.
And then the tadpole swim, the sperm swims?
Yes, it swims faster than you think.
Really?
Really, yeah. The swimming happens within 48 hours and it reaches the egg and it fuses with the egg and there the baby starts to develop.
But only one.
Only one
Get
reaches. Get to reach the one egg, not two. Then it results in twins or multiple gestation.
But only one sperm can make the miracles for twins, for triplets?
Yes, the one sperm divide the egg into two and then happens the twins. But that is the rare possibility. But one healthy sperm with good head, good tail, swimming up to the good egg, waiting in the fallopian tube, then the miracle always happens.
Doctor, why 48 hours?
Yes, because after 48 hours, the eggs move from the fallopian tube. See, the lady is now waiting for its partner, for the friend to come up, swim up, and do the dating there. And if nothing happens, now it loses its hopes and the egg slowly swims down into the uterus and it goes into the phase of menstruation. All the hormones.
It dies.
Yes, it comes out during menstruation. So, it waits for 48 hours. First 48 hours is very crucial during the ovulation period. At the max, 72 hours.
Max 72 hours.
Max 72 hours.
What is the crucial hours?
The crucial hour is 36th hour.
36 hours.
Yeah, 36th hour.
Oh my God. Madame, bon monsieur qui peut regarder nous là bon matin, un petit peu si c'est assez critique qui peut cause là, mais en même temps nous pouvons besoin cause là bien si nous peut cause fertilité bien si de bonnes hommes la façon qui y peut aller pour nous capable bien si madame qui espère 48 heures de temps maximum 72 heures de temps pour nous gagner un petit baba bien si nous dépend un petit peu nous autres nous aussi nous parfois par exemple dit nous gagne blanc mais pour dire non mais seulement 50-50 et tout les deux côtés. How can you tell when a man is infertile?
Now, the male factor is very difficult to analyze. That is the key we are discussing here. Mostly men hesitate to come to the clinic for examination.
Why is that?
Because they have to take their sperm out, study it under microscope and face the reality. It's like they are going through a tough phase.
They are shy, isn't that?
They are shy. They are forced to take the semen out. You know, that doesn't happen naturally. So they are forced, they are put under a lot of pressure. And you know what? When the person is under a lot of pressure, the results are not that good.
Yes.
So 2 days of no sex and no pressure, the results are the real one. If they are under too much pressure, then a lot of dead cells can be seen, dead sperms can be seen. So it is like kind of a difficult phase for men to go through, but it is the easiest also. Once they understand the procedure, it happens only in 15 minutes in and out of the clinic.
15 minutes?
Yes. When they walk in, they have to just meet me and tell like, we are not, the couples usually discuss that we have been trying for such and such a time and nothing happens. And we really have to focus on the male factor first, exclude it before focusing on the female factor. Because on the female factor, we have 3 or more factors to consider. But for men, it is only one.
Only one.
So you exclude that and then focus on the lady. If the most, in my experience in Seychelles for the past 1.5 years, I've been coming every month. I see the male factor as a predominant one compared to the female factor.
Compared to the female?
Yes.
Oh, how is that?
That is probably because the sperm count is low or having abnormal head-tail patterns or dead sperms inside. Probably because of too much of stress or poor lifestyle or not taking enough care on their health.
Does that mean the sperm is not healthy? Poor lifestyle?
No, not all. The sperm is healthy, but the amount of stress and the lifestyle they live has to be changed. Lot of fresh fruits and greens to be added in the diet.
But some fresh fruits, greens, eat your greens, fresh fruits in your diet for a healthy sperm.
And add 3 liters of water daily. Yes, drinking 3 liters of water.
3 liters of water.
3 liters of water daily. It washes the toxins away from the body. So nothing stays inside. So the toxins don't go and attack these sperms.
Ah, voilà. Quelque chose que nous pouvons apprendre aujourd'hui bon matin, bon hommes, bon qui peut hésiter un petit peu, bon qui peut kami pour consulter avec un gynécologue, bon qui parle des autres cliniques. Voilà un petit peu bon tips. Eat your greens, eat your fresh fruits, bien sûr. 3 litres d'eau, bois par jour, bien sûr, pour a healthy, for healthy sperm, bien sûr. Other options, if the man is too shy, it's under pressure to come to the clinic to get the sperm out. Can it be done at home?
Yes, it can be done at home, but the doctor should be informed prior because the transportation time from home to the clinic should be within 15 minutes. Because exposure to the external environment can itself give an altered report that will shut down the men mentally. So, if they are ready to give the sperm getting collected at home, then they have to reach the clinic within 15 minutes
15
for
minutes.
study. Because once we collect the sperm, we put it on the heating block and we liquefy it. It is not as viscous when you see, it's not very jelly-like, it becomes watery-like. So, the key factor is to make it watery once it reaches the clinic. So, the transportation time is maximum allowed to be only 20 minutes, not later than
That's
that.
crucial.
Very crucial.
What do you recommend, doctor, as a gynecologist?
As a gynae, I would recommend them prepare mentally. It is a normal process. Yes, we are going to study, accept the fact that the sperm or the semen is going to be analyzed. Please collect it in the clinic, because the fresh sample always gives the better result. And you know, once it's collected at home and the transportation, the leakage, or that gives them the wrong result, it is like a lifelong mental trauma they are going to go through. So, it is only a 15 minutes of pain, and later not to worry, because you get the result spot on and you know that your sperm count is absolutely normal, or what is the picture of your sperm analysis, spermogram still tells you. But if it is collected at home, even as a gynae, I will suspect like what was the time of collection, what time it got into the lab, and what is the why is the liquefaction or the change from jelly-like to watery is not happening. So, these are the questions that arises in me.
Doing it at home is very crucial. It can be done, but it's very crucial.
Very crucial. If you are living close by, you are able to reach the clinic in this no traffic zone, then prepare the time.
Lord. Don't say traffic, because otherwise not good.
Yeah.
If it reaches after 20 minutes, not good at all. You have to throw it away.
Gone. Yeah.
And do the process again?
We don't throw it away. We still read it, but I don't declare the result unless I go for the second analysis. Always when a sperm analysis is done, if I find the sperm test not so very good, I always ask for a second sample, because this is like stamping that the sperm is not healthy, you have very low count, and I have to analyze what are their dietary habits, what is their lifestyle like, what kind of work they are put into, what is the stress level. All these are analyzed before declaring the result of abnormal spermogram or sperm test. I always ask for a second sample that needs to be collected only in the clinic. With me, it's in the clinic.
It's in the clinic with Dr.
Suganya.
Et tout est procédé, bon homme, oui, un petit peu, qu'est-ce qu'on compliqué, un petit peu, ça, mon capable de comprendre, mais seulement, comme ça, quelque chose, et pour gagner faire une option, qu'il y en a. Has it occurred, or has it happened, I don't know, maybe rarely, that the sperm is premature?
The sperm is premature because it has to travel from the testis and reach the point of ejaculation. I put it in simple terms. Why premature ejaculation or premature sperms? Which of the one is the point of discussion? Both I will discuss. Premature ejaculation is the one before you insert, all the sperms come out. Before the sexual act happens, whole of the sperm spillage happens. But the premature sperms is not grown properly, that is the size of the sperm is smaller.
It's small.
Yeah, with lot of millions of sperms pushing down, these premature sperms also try to come down, but they don't swim up. They don't do the swim up technique. They don't reach the eggs.
C'est pas un disef du tout, ça veut dire, en d'autres mots, dans nos beaux termes créoles, bien sûr, c'est ça qui nous peut demander aujourd'hui, bon matin, bien sûr. And then, what happens? What is the process? When it reaches the clinic, 15 minutes?
Yeah, and then we study it under the microscope, only one drop. The one drop we study, we put it in the counting chamber, and then we analyze how many millions are there. Ideally, it should be greater than 20 millions. Though the mark is 20 million,
20 million.
20 million sperms, I always recommend all the couples who are working for fertility to have the sperm count more than 30 to 35 million at least, because of the 20 million, the 5 million won't be swimming up, the 2 million will be abnormal, the 1 million will be having pus cells or the infectious one. So we cannot trust that. Always have above the margin greater than 30, and it's always better to have the value greater than 30.
Than 30.
30, yeah. Though 20 is the mark, 30 is always better.
Madam Banzom, we should be proud of men. Look at the figures we are talking, 30, 20. So that's a lot.
Millions.
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 And that's ça, because 30 millions, 20 millions, but only one gets to
Yeah, swim up.
fertilize.
Exactly.
This is crucial.
Yes, that's a miracle.
Yes.
Miracle that happens with one sperm reaching
From the 30 million.
From the 30
Only
million.
one gets to reach the egg.
Yes, and decides whether it's a boy or a girl.
And the same one decides whether it's a boy or girl.
Yeah.
Or twins.
Yeah.
Ça, un vrai miracle dans création mondiale. On est capable de dire un vrai miracle dans un sperme, il fait quantité miracle lui-même. Bien sûr. We have questions from our viewers. Dr. Suganya, good morning. If a man ejaculates fast when it's having a sexual intercourse and a sex activity, is it a risk for infertility?
Yes. Good morning.
The question
to
is
her.
in Creole. I have translated.
Good morning to her and tell her, yes, premature spillage of the sperm is one of the commonest cause of male infertility, because everything is deposited outside the vagina or faster. See, it has to be deposited inside the vagina to reach the cervix, and swimming up takes place. So if it is dropped outside, then there is no point. It is exposed and it is dead spot on. So it is one of the reason for male infertility, premature ejaculation. She's very true. Yes, she's correct. She needs to approach us for treatment.
There goes your answer. Pour qu'il demande ou la question là ou la réponse. Merci. Or if not, you can always consult Dr. Suganya. You are here until when?
Until this Saturday.
Until this Saturday.
3rd of May.
May.
At Dr. Murthy's, and they can book the appointment and meet me, or call up for appointment on my personal number itself. It's 2750 999.
Can they walk in?
Yes, of course they can walk in. I'm here until 5 p.m. at the clinic, and I'll do my best to evaluate them. What is the problem? What exactly is the factor? And then we can proceed further and make couples become fertile or carry the magic of parenthood.
The magic, she can make magic. So can it happen if after all your analytic, you find that the man is infertile? Can it be
corrected? Yes, there are now 3 options. One, we give them medications, because usually stress is the commonest factor pulling the sperm count down. So, and other habits like smoking, alcohol also brings down the sperm count down. Of the smoking and alcohol, smoking is very dangerous, because you have this movement of sperms happening, and that movement has to be encouraged by the tubes lined by a thin carpet like the fluffy layer. So the fluffy layer pushes the sperm, the fluffy layer, cushion layer pushes the sperm from point A to point B
to point C.
Yes, like that. But this smoking, the nicotine, damages the fluffy layer, make it rigid, and no movement happens. So I advise them, if they are smokers, refrain from smoking. And alcohol intake exactly does the same, but it creates lot of abnormal sperms, like double-headed sperms, no tails, like that. So step 1 will be lifestyle modification and dietary modification. Step 2, we can give them medications, but the medicines, they have to be patient enough for 3 months. I'll tell you 3 months, because I tell you, for the healthy sperm to develop the new one and come up, it takes 53 days. And finally, to get it ejaculated, 59 days.
After 59 days?
Yes. So 2 months period at least is required, but for all my patients I go 1 month. An extra mile is always better. So mentally they have to prepare themselves that for 3 consecutive months they have to take their pills on a regular basis, and once they take it, after 3 months we redo the sperm test, semen test, and we can see the difference for ourselves. And once the difference is made, then if the difference is very positive, if the result is very positive, I ask them to go for natural consumption.
Natural consumption.
Yes.
If it's not that positive.
If it is not that positive, then there are 2 techniques that we imply. One is intrauterine insemination, which is IUI, which is done in Dr. Murthy's by me. We have a good IUI lab set up, the latest one, where we collect the sperm, study it under microscope, and work it in a way that of the 20 million, it forms into a size of a pellet. The pellet or a size of a mustard, everything glued together, and then we work on it and aspirate and put it inside the womb directly.
How effective is that one?
It is very positive. The results are almost 70% positive. The couples can become, she has to be on her ovulation time, and we give medicine for the lady as well to release good eggs, and once the good eggs hatches and comes, we time it in such a way that the collection happens, the process happens, and then we withdraw and put it directly inside the womb. Yeah. For the men with very low sperm count, this is a very ideal technique, because of the 20 million to swim up, the sperm finds it difficult in a natural way. Here we condense and make them into a glue, like in a mustard size. Lot of millions of sperms of the 20 million, the healthy ones are settled in the bottom, and we take it in a special cannula and put it directly inside the womb.
What is the risk of that one?
No risk.
No risk at all?
No risk at all.
No side effects?
No side effect, no risk. All we have to do is watch for the days to get crossed, a menstrual cycle to get crossed, and do a urine pregnancy card test and see for the double line.
If the double line doesn't come, doctor, in your experience as a gynae, has it happened, or have you ever had a failure in this process?
Failure cases, yes, we expect failures to happen. See, not all procedures, we have to be very honest here. I cannot tell 100% success rate and come to my clinic, I can give you babies. No, nothing like that, because of, take it for 10% if I do IUI, 3 go for the failure rate, all right? But 7 conceive. Let's be positive, we fall into the 7.
7?
7, yeah.
Oh.
7%. Of the 10 IUIs, 3 goes negative, 7 goes positive. So the choosing or the case selection, preparing them before the procedure is the key factor here. Preparing them, both the male partner and the female partner, preparing them with medications, with injections, or with the, we know how it works, and timing the IUI is very, very important. If failure happens, we can accept up to 3 IUI cycles if it fails.
3?
Then 3. 3 IUI cycles is failed. Please don't waste any more time, because clock is ticking.
Yes.
The lady is losing her eggs. With every year passing by, the count goes down. Then go to the next method called IVF.
IVF.
Yes.
This is the most popular one.
Yeah, the
IVF.
most popular and the most successful also.
And the most successful one as well. So somebody is asking about the aging, about the process we are talking right now, the aging, the right age.
For the men to
For the
do,
men.
or the lady.
Yes.
Okay, both can try less than 43 years.
43.
43 to 45 is the mark.
This is the limit?
Yeah. After
43,
that,
45.
yeah, the reason I'll tell you, 45 for the lady is the mark. After 45 years, her egg production level goes down. The quality of egg becomes a compromise here. So whatever you try it before 45. the lady reaches the age group of 45. After 45, don't go for the IUI technique, go for the IVF technique. That is more successful because there we are removing or extracting the egg directly from the ovary, selecting the good egg, selecting one good sperm, making it form a baby. So that is more successful. So above 45 years, don't wait or don't go for this IUI. Try it once. If it doesn't happen, switch over the technique.
Switch over the technique. If it doesn't happen, mais pour nous qui peut en vie, bien si, faire nos familles, bien si, considérer. Ben là aussi, tous les jours nous venons oublier vieux, ben là, il vraiment important parfois il critique là nous peut sauter 40 ans en montant. Alors si on veut faire aux enfants, mon considérer pour faire en bas 40 ans. Under 40 years, it's okay.
Yeah.
To form your family.
Yes.
To build a family.
It is good. Always it is good. The younger, the better.
To build a family, it's under 40 years.
Yes,
good.
It's good.
With a good sperm.
Yes, with a good sperm and the good quality of egg. The quality of egg is also very good at that time. After 40, with every year, it drips down.
Questions from our viewers, Doctor. Good morning, ladies. Good morning to you. This lady or this man said, okay, she or he is taking tablets. 100 mg tablet really helps me with strong erections and fertility. Okay, this is a man. And fertility. Do I continue with it? Is there a long-term side effect?
Yes. See, he's very correct. His problem is erection.
Erection.
So for erection, he is taking the tablet.
Yes.
On a long run, the nerve that is supposed to get stimulated with the medication loses its energy. Aging happens everywhere. Every cell of your body
gets aged.
Gets aged. So considering that, reserve the medicine if they are planning for pregnancy or if they are planning not on a daily routine basis. See for alternatives why the erection problem is happening in the first place. Like look into the, they can come for consultation. I can give them a diverse analysis of what is the reason for erection not happening in the first place. And we can correct it there instead of going for the pills. You can have the pills, but as I said, every cell ages in its own pace. So the response to the medication also gets weaned off on a long-term use basis. And the side effect, because the medicine doesn't cause erection after a long time usage, now the man really questions his fertility potential.
Fertility potential, yes.
Then it brings him down psychologically, which is a major side effect. Disappointment, the mental trauma, the traumatic stress disorder he goes through. It's very, very difficult to pull him back on track. So catch him early, treat him early, and give him the best result. That is my whole
His
goal.
question was, do I continue with it?
Let him have a consultation with me. I'll really see where lies the problem, and then I can suggest whether he needs to be continued on a daily basis or we can arrange a plan for the consumption day.
Voilà, it's best que vous faites là comme docteur Suganya là, que docteur Mouti, sonner les temps jusqu'à samedi, bien si vous capable passer, juste pour faire un petit peu test, so ta va guetter quelque chose et là on connaît si pour continuer avec sa pilule ou pas, ou sinon il y a les autres options qui est capable advice ou bien si bien quand même, juste passer un petit coup avec docteur Mouti ou besoin avec docteur Suganya ou quasi score mettre un appointment mais si tu as de la ville ou de la ville, c'est un petit coup là-bas côté docteur Mouti ou capable consulter avec docteur Suganya, bien sûr, pour capable gagner. Ou la réponse, bien sûr, qui ou peut aider, n'est pas là, nous sommes avec nous les corps, il pas veut dire qui ou pour désappointer, mais seulement at least ou connaît. It's better safe than sorry. I always say that.
Yes,
it's better safe than sorry. Okay. Somebody was asking earlier regarding perimenopause. We are talking about infertility in men, but perimenopause is in women. It doesn't mean that women going in the stages of perimenopause can be considered as infertility.
Yes, see, up to the age of 50, that is the last age for the lady to conceive. Yes, 50 is perimenopause,
yes.
But we know the quality of egg really matters.
Yes.
So if at all she has decided for pregnancy, then tick the option 2 of IVF, retrieve the eggs that is possibly available and keep it frozen, then she can conceive. Artificially, yes, but still it can happen.
It can happen.
Yep.
Doctor, maybe a couple is asking, do you do, while you're here in Seychelles, do you do IVF here or they have to go abroad?
They have to come abroad. To my hospital. Yes, in my hospital I do IVF. Here I do IUI. That's a small video clip I have got, so I can explain about IVF. If they can play it, then maybe it's easy for me to explain what is this IVF. Most of them are worried that this is a very complicated procedure, very difficult one. So I can explain to them it is not as complicated as it is there in the Google. They do a lot of research in the Google, they study so much, but it is not so. The average time span required for their presence in India or in Chennai in my place will be only maximum of 15 days.
But you can consult them for IVF here while you're here in Seychelles?
Yes, I can do the consultation here, I can do all the groundwork here and make them fly only for the retrieval.
Only for...
Yep.
Voilà, nous sommes capables de faire une consultation pour IVF ici, voir quelque chose, après voir si travel côté son l'hôpital,
Sugan Hospital.
Sugan Hospital, bien sûr, après d'avoir fait quelque chose, je peux considérer IVF, ce n'est pas trop tardé. On comprend à cause aussi. It is successful.
Very successful.
90 point.
Yes.
99.9 successful.
Now, see, I will be very honest here. It is 97% successful.
97%.
Yes, the 3%.
Successful.
Yeah, the 3% is the aging, and the last age limit when the men come at 55 years, the sperm count is very low, and the lady coming at 50 years. But we do give good results. It's all.
Keep fingers crossed.
Yeah, miracle always happen.
It does. Mais en même temps que nous pouvons causer, Dr. Suganya, tu amènes une petite vidéo pour partager avec nous, bien sûr, pour expliquer un peu sa procédure qui nous peut cause là, topic qui nous peut adresser aujourd'hui bon matin, sa petite vidéo qui nous envoie pour nous, en même temps que nous pour aider, bien sûr, il peut causer un petit peu sa vidéo qui nous peut aider là. We are talking about the video.
Yeah, I can explain. As the video is
we need
played,
explanation.
Yes,
so,
I can.
Yes. Nous posons sa vidéo, en même temps, il va expliquer nous. Voilà, voilà sa vidéo.
See, every
New year,
baby.
new beginning.
Yes, new year, new beginning. Yes, see, the procedure starts with injection for egg production.
Yes.
So, this happens after that is the ovary, and there you can see multiple eggs. Normally, the lady releases only one egg. Now, this is a procedure that is done slowly through the vagina. We reach the ovary through a very, very small microneedle, similar to a laparoscopy, and take the egg out from the ovary. See, that is a puncture made, and the eggs are collected from the ovary. And this is the dish where we place all the eggs that are collected. And from this, after washing, see, those are the good eggs.
The good ones.
Yeah, the very good ones. Yeah, and
healthy ones.
That is the sperm now we are going to put inside, and the division occurs. Can you see? We have now 4-cell stage, 8-cell stage. This is the grade B, like we have various grades. This blastocyst stage is ideal for the embryo transfer. We collect it and then put the cannula inside the uterus and place it inside the uterus. The 4th cell and the 8th cell starts multiplying, and the baby of a poppy seed starts forming inside the uterus, and the heartbeat is made at around 6 weeks. This is the look of the placenta. Now the baby is now receiving all the blood supply. It is treated as a very, very normal pregnancy. Once the baby is inside the womb, it will receive all. See, started its moving. Yes. Yeah, so reproductive, urinatory, so everything it starts secreting. It is able to listen to voices at 12 weeks. So be careful what you talk, what you listen to when you are carrying a baby inside. So reaches out for this miracle to happen. Reach me out. I am giving all positive results, a good healthy baby. And twins are a possibility possibility with IVF, because we put minimum 2 embryos inside. So, if 2 catches, then multiple gestations are very quite common with our centers ideally, but 2 embryos ideal for a transfer.
It's ideal for transfer.
See, as you see, it's a very, very simple procedure. We don't have to cut, we don't have to do a big operation, nothing like that. It is the technique. It is very painless. The lady will be sleeping for 10 minutes to get the eggs collected.
All of that is only 10 minutes?
We have to be really very quick, because under anesthesia, we don't want the eggs to get delayed. See, as I said, the crucial time is the 36th hour. So, on the 36th hour, I will be retrieving all the available eggs. We have collected to a max of 20 eggs in 10 minutes. So, we have to be really quick and transferring into the dish, that is very important. And then we put the one healthy sperm. We collect the one sperm which is very healthy and then make the baby happen.
All this happens very fast.
Very fast.
In 10 minutes, and the baby is healthy?
Yes.
Even if it's twins?
Yes. Why not? Yes.
I'm just asking.
Yes, the babies are very healthy. Ideally, after the collection, we freeze the embryo, and 3 months later, then we thaw it and place it. Prepare the womb properly, and that is where the success really matters. Never rush when you're into this IVF. It is very quite common for the lady to be anxious, for her to be like know the results immediately, want to carry the baby.
Yes.
As a mother myself, even I would want it immediately. Why wait for the 3 months? But the 3 months waiting period is the crucial period.
And it's necessary.
Yes. The womb has to be prepared to receive the embryo. So, never rush. Fresh transfers, usually I don't go for the fresh transfers. It is always the frozen transfers that does the maximum result. From 97, I can jump even to 99.
Really?
Yeah.
From 97 to 99?
99.
But the mom to be, she doesn't have to be under stress and pressure
Yes.
while waiting in the 3 months.
Yes. No, she will be absolutely free. Once she comes to know her embryos are started to divide and kept it aside, the reason for erection not happening in the first place, and we can correct it there instead of going for the pills. You can have the pills, but as I said, every cell ages in its own pace. So, the response to the medication also gets weaned off on a long-term use basis, and the side effect, because the medicine doesn't cause erection after a long time usage, now the man really questions his fertility potential.
Fertility potential, yes.
Then it brings him down psychologically, which is a major side effect. Disappointment, the mental trauma, the traumatic stress disorder he goes through. It's very, very difficult to pull him back on track. So, catch him early, treat him early, and give him the best result. That is my whole goal.
His question was, do I continue with it?
Let him have a consultation with me. I'll really see where lies the problem, and then I can suggest whether he needs to be continued on a daily basis, or we can arrange a plan for the consumption day.
Voilà, it's best que vous faites là comme docteur Suganya là, que docteur Mouti, sonner le temps jusqu'à samedi, bien si vous capable passer juste pour faire un petit pété, ça va gâter moi quelque chose et là on connaît si pour continuer avec sa pilule ou pas, ou sinon il y a les autres options qui est capable advice ou bien si bizarre comme juste passer un petit coup de docteur Mouti ou besoin avec docteur Suganya ou quoi juste qu'on mette un appointment, mais si tu as de la ou de la ville, c'est un petit coup là-bas côté docteur Mouti ou capable consulter avec Dr. Suganya, bien sûr, pour capable gagner. Ou la réponse, bien sûr, qui ou peut aider, n'est pas là, nous sommes avec nous les corps, il pas veut dire qui ou pour désappointer, mais seulement at least ou connaît. It's better safe than sorry. I always say that.
Yes,
it's better safe than sorry. Okay. Somebody was asking earlier regarding perimenopause. We are talking about infertility in men, but perimenopause is in women. It doesn't mean that women going in the stages of perimenopause can be considered as infertility.
Yes, see, up to the age of 50, that is the last age for the lady to conceive. Yes, 50 is perimenopause.
Yes.
But we know the quality of egg really matters.
Yes.
So, if at all she has decided for pregnancy, then tick the option 2 of IVF, retrieve the eggs that is possibly available and keep it frozen, then she can conceive. Artificially, yes, but still it can happen.
It can happen.
Yep.
Doctor, maybe a couple is asking, do you do, while you're here in Seychelles, do you do IVF here or they have to go abroad?
They have to come abroad. To
Abroad.
my hospital. Yes, in my hospital I do IVF. Here I do IUI. That's a small video clip I have got, so I can explain about IVF. If they can play it, then maybe it's easy for me to explain what is this IVF. Most of them are worried that this is a very complicated procedure, very difficult one. So, I can explain to them it is not as complicated as it is there in the Google. They do a lot of research in the Google, they study so much, but it is not so. The average time span required for their presence in India or in Chennai in my place will be only maximum of 15 days.
But you can consult them for IVF here while you're here in Seychelles?
Yes, I can do the consultation here, I can do all the groundwork here and make them fly only for the retrieval.
Only for...
Yep.
Voilà. Nous sommes capables de faire une consultation pour IVF ici, voir quelque chose, après voir si travel côté son hôpital,
Sugan Hospital.
Sugan Hospital, bien sûr, après avoir fait quelque chose, tu peux considérer IVF. Ce n'est pas trop tardé. Vous comprenez, à cause aussi, it is successful.
Very successful.
90 point.
Yes.
99.9 successful.
Now, see, I will be very honest here. It is 97% successful.
97%.
Yes, the 3%.
Successful.
Yeah, the 3% is the aging, and the last age limit when the men come at 55 years, the sperm count is very low, and the lady coming at 50 years. But we do give good results. It's all.
Keep fingers crossed.
Yeah, miracle always happen.
It does. Mais en même temps que nous pouvons causer, Dr. Suganya, tu amènes une petite vidéo pour partager avec nous, bien sûr, pour expliquer un peu sa procédure qui nous peut causer là, topic qui nous peut adresser aujourd'hui bon matin, sa petite vidéo qui nous envoie pour nous, en même temps que nous pour jouer, bien sûr, il peut causer un petit peu sa vidéo qui nous peut jouer là. We are talking about the video.
Yeah, I can explain. As the video is
we need
played,
explanation.
yes,
so,
I can.
Yes. Nous posons sa vidéo, en même temps, il va expliquer nous. Voilà, voilà sa vidéo.
See, every
New year,
baby.
new beginning.
Yes, new year, new beginning. Yes, see, the procedure starts with injection for egg production.
Yes.
So, this happens after that is the ovary, and there you can see multiple eggs. Normally, the lady releases only one egg. Now, this is a procedure that is done slowly through the vagina. We reach the ovary through a very, very small microneedle similar to a laparoscopy and take the egg out from the ovary. See, that is a puncture made and the eggs are collected from the ovary. And this is the dish where we place all the eggs that are collected. And from this, after washing, see, those are the good eggs.
The good ones.
Yeah, the very good ones. Yeah, and
healthy ones.
That is the sperm now we are going to put inside, and the division occurs. Can you see? We have now 4-cell stage, 8-cell stage. This is the grade B, like we have various grades. This blastocyst stage is ideal for the embryo transfer. We collect it and then put the cannula inside the uterus and place it inside the uterus. The 4th cell and the 8th cell starts multiplying, and the baby of a poppy seed starts forming inside the uterus, and the heartbeat is made at around 6 weeks. This is the look of the placenta. Now the baby is now receiving all the blood supply. It is treated as a very, very normal pregnancy. Once the baby is inside the womb, it will receive all. See, started it's moving. Yes. Yeah, so reproductive, urinatory, so everything it starts secreting. It is able to listen to voices at 12 weeks. So be careful what you talk, what you listen to when you are carrying a baby inside. So reaches out for this miracle to happen on the frozen part. That is the what do you say? her embryos have passed or crossed the dangerous zone. So I give all the counseling, the baby is safe, we make sure the mother is under no stress at all, or the mother to be is under no stress
No
at
stress
all.
at all.
At all.
At all. Otherwise, the miracles will not happen.
Yeah, the anti-hormones like the cortisol, steroids get secreted in excess and does the damage before I think or she thinks. So we need to counsel, we need to mentally prepare ourselves. Patient is a virtue to be followed.
Ladies, if you are above 45 and you're considering IVF, go for it. Dr. Suganya, il a comme Dr. Mouti, bien si ça semaine jusqu'à samedi, go pour have yourself checked. Et si vous envisagez là, ça m'a comme on dit mon vie, faire mon famille, build my family, one more to go in the family, so why not? Ou I'll cut Dr. Suganya, and she's there until Saturday. We are hearing from our men this morning, and this one says, "Good morning, Carol and Doctor. I am 50 years old, and can you ask doctor if I'm infertile? Can you make me fertile?" 50 years old and infertile.
No, he cannot be infertile at 50.
He cannot be.
Yeah, he can still have his sperm test done, and we can do the analysis and make him fertile. 50 is not the benchmark.
And how do you know you are infertile at 50?
Yeah. No way. Unless and until you do a sperm test and make yourself analyzed. Don't get labeled as infertile. Infertile is a very big word. And 45 age is not, as you put in your previous explanation. I recommend this IVF for all those couples who are trying to conceive. And the pregnancy is not happening after one complete year of natural way of trying. Then they have to approach their gynae and look for methods. And be it 25, be it 26 or be it 35, the earlier the better results. Or the mother or the lady is recurrently losing the baby, repeated abortions, means the baby is not in a healthy shape. The embryo is, she's able to conceive naturally, but the embryo is not able to sit inside the uterus. So in that case, we prepare the good ones with good genetic concentration. Make sure the baby gets glued in the uterus.
In the uterus.
Yes.
And mademoiselle, aujourd'hui, bon matin, Dr. Suganya explique tout ça, bonne procédure, bien si infertilité de bonnes hommes, bien si vous sentez, il y en a, nous voyons un peu de temps, un peu de nos propres corps, il y en a qui nous sentent, parfois, nous sentons désappointés. Pas besoin de coller avec les autres corps, because you can be wrong. You can be wrong. The only way to know that is a consult avec un gynae, bien si, et the only way, c'est là que Dr. Suganya, il a jusqu'à samedi. Why not? Ou passe une petite visite là-bas avec Dr. Mouti, bien si, ou fait un petit test, better safe than sorry. Avant là, ou l'amour les corps, moi fertile, ou désappointé, ou ici ou là-bas, même nous, si nous bonne madame, parfois nous faisons ça, nous blâme camarade, nous blâme monsieur, blâme madame, il blâme monsieur. Zot, donc bonne gynae, là, zot, only then the specialist can tell you whether you're fertile or not. Do not, pas besoin pour sa perception ou même, vous dire, moi fertile, moi ici, moi là-bas, zot, alors que gynae, comme Dr. Suganya, il a. Dr. Suganya, to conclude, I give you the last word today.
Yes. I always tell this, please reach out to your doctor or the gynae as early as possible. The earlier, the better, because certain problems can be solved by simple medications, simple techniques that doesn't make you land up in the complicated ones or the very difficult ones. Reaching out is the key. Please reach out to me. I am here every month. Mope Vini Cesal Bensis May.
26 mai.
Yeah.
Next time,
So,
next rendezvous,
yeah.
le 26 mai.
Le
Dr.
26.
Suganya, il a
Yeah.
alors call now to book your appointment for May, or now it's just
Now,
walking.
I'm here until May 4th. And as I said, please don't lose hope. Miracles always happen. And that is the way I conclude. Hope is there for everybody who are very positive. Change your diet, change your lifestyle, and expect miracles.
It does happen. Dr. Suganya, thank you so much pour
Merci.
aujourd'hui bon matin, pour faire le temps,
Merci.
pour venir joindre moi. Nous expectons joindre encore mon procès. Ici, de bonjour Cécile. Entre-temps, passez bonne journée, bon courage. Until Saturday.
Yes, until Saturday.
Cécile, ça c'est le topic. Conversation.